Hi, my name is Martin Doyle. I'm a physiotherapist and I'd like to introduce you to a new heat pad that I use for treating my patients. But prior to that, I'll just tell you a bit of the history of how I use heat in my practice. As a student in the hospital systems, we used to use wax baths for people with rheumatoid arthritis and osteoarthritis. We'd submerge their hands in the wax and then they'd rub it off. People who had hip and back surgery, we put them in hydrotherapy. The warmth helped them move easier and facilitated their healing. And also in private practice, I use heat pads that I put in microwaves. I also have stick-on patches that I use for people with musculoskeletal pain. And I was using this as well, where I boil the water, we pull this out and we wrap it in a towel and we put it around patients as part of the pain management. And the idea is to increase blood flow to the area so we facilitate their healing. So heat's been used it's as old as mankind. We also use, as physiotherapists, we do a lot of manual therapy, we do frictions, we use ultrasound, and again, the purpose of that is to increase blood flow to the injured area, and by increasing blood flow, we bring oxygen, and we take away debris, and we facilitate healing in conjunction with specific movement exercises appropriate to that injured joint. Not too long ago, a patient came in who had shoulder reconstructive surgery, and she brought this product in that she was using at home as part of her heat therapy. And when the patient brought this product in and informed me that it was far infrared moist heat, when I did the research, it showed that for pain management, it's the moist heat that's more beneficial than the dry heat. And unfortunately, the products like heat pads and the hydrocolators is primarily dry heat. So it's only superficial on the skin. Whereas if you look at the research on pain management for various musculoskeletal conditions, it's the moist heat that's far more beneficial. And the reason being is that moist heat penetrates. It penetrates the skin, it penetrates into the muscle, and by there it brings more blood flow to tissues that have been injured to facilitate healing. And this product in particular has ceramic pads inside. It also has coral sand. And when they're heated up, they form or they produce far infrared heat. That's the heat you get from the sun, the most therapeutic heat. And what happens then is this polyester cotton cover only requires a small amount of moisture from the atmosphere. When you see the manufacturers, they'll put a piece of glass down and they'll put this on for a few minutes and you'll see the moisture on the glass, so you know it is producing moisture. And what the moisture does, the moisture facilitates the infrared penetration into the tissue. And that's why it's a far superior product. And that's why this product, when we brought it in a couple of years ago, the TGA classified it as a medical product because it has a physiological effect on the body. It's increasing blood flow. It's not an electric blanket, it's a medical product. And it's also the reason why the Physiotherapy Association have endorsed this product as a product to be used by allied health professionals and as a safe product. It also has built-in safety. You can set the time, you can set the temperature. It's one of the professionals, it's good in hospitals, nursing homes, private clinics. You just turn it on, there's no boiling water, there's no hydrocolators, there's no boiling heat pads in the microwaves. It's simple, it's quick, and as a physiotherapist, it really changed how I used heat in my practice. Prior to that, I would get the practice manager. She'd be running in and out with heat pads. I'd be having to boil the hydrocolator, pull the pads out, wrap them in towels, empty the hydrocolator. It was a nightmare. And when I came to use these, it made my life as a clinician wonderful. I could just plug it in. I could then just I could get the heat in 2 or 3 minutes. But even more importantly than that, patients loved it. Because it was infrared, it was moist, it was wonderful. It was a wonderful form of heat that patients like, and that's why I've taken the time to bring this product in. It's because it's the only product I've ever come across that I've found to be beneficial for clinicians and, more important, beneficial for patients.